Welcome back to the second video in the series of nitrous oxide training. Uh, my name is Dr. Varela, and we're going to pick up where we left off. And where we left off was we were going to start this conversation about the indications for nitrous oxide sedation. And there's three general groups of patients that really nitrous oxide is indicated for. The first is those patients that need management of fear and anxiety. The second is the medically compromised patient, which we'll talk about. We'll talk about these medically compromised patients in the vein of managing their fear and anxiety. And the third group of patients where nitrous oxide is indicated is those who need management of gagging. So let's go ahead and get started. So, like I said, when we talk about reducing anxiety, we're not just talking about those patients that have really bad dental anxiety. We're also talking about reducing anxiety for these medically compromised patients. We'll take, for example, somebody who has myocardial ischemia, which is usually represented by angina. Okay, so reducing anxiety helps to reduce myocardial ischemia because it helps to reduce the heart rate and the force of contractility and myocardial workload. Now, nitrous oxide is not administered on its own, it's administered alongside oxygen. And so receiving approximately 50% oxygen helps to reduce oxygen deficits responsible for the onset of those angina symptoms and really elevates that pain threshold. Now, nitrous oxide can help in situations such as during an acute myocardial infarction. And nitrous oxide has also been found to be the most appropriate technique of sedation for the patients that have pre-existing cardiovascular disease. So, in summary, because you are administering oxygen along with this nitrous oxide, you are also administering oxygen to these patients that have myocardial ischemia in the form of angina. And really think about what angina is. It's basically pain due to an oxygen deprived heart. Okay, so the heart's not getting enough oxygen. So now with nitrous oxide, you're introducing additional oxygen that the patient is not getting from the environment. And so that really helps to satiate the heart that is starving for oxygen. And so that pain threshold increases. So, in other words, a larger event will be needed to really kind of activate that same pain reaction. And hopefully that makes sense. Now, nitrous oxide can also be administered safely to patients with asthma because what asthma is at its base is basically the irritation of the bronchial tree. It's an inflammatory reaction. And it's also really big help for patients whose asthma is stress-induced. And you can think about that. It makes sense. If you can lower the stress, you lower the likelihood of the asthma being triggered. On the other hand, some other respiratory diseases such as COPD are kind of a relative contraindication for the use of nitrous oxide. And that's because really COPD patients don't suffer from an inflammatory response necessarily. It's not. It doesn't have to do with some sort of blockage of the bronchial tree. It really has to do with the destruction of some of those alveolar sacs that are really critical for gas exchange in the lungs. And so if you are occupying more of those gas exchange sites with nitrous oxide instead of oxygen, then you're really decreasing the COPD patient's ability to be able to breathe in enough oxygen. So they can have really bad side effects. Now, I will give you a quick warning. I am recording this lecture inside the faculty office at Greenwood, and so I may be interrupted. So if you do happen to hear some interruption or noise in the background, I apologize about that. So continuing on with this conversation of medically compromised patients, you'll notice that a really common theme with a lot of these patients is stress. And the purpose of this nitrous oxide is to help to reduce the stress on these patients. And for patients with compromised medical situations, reducing the stress is really essential because stress affects all of their physiological processes. And if these processes go out of whack, the patient's medical stability can really be negatively affected. Now, for stroke patients, reducing stress can help reduce blood pressure. Now, stroke patients don't tolerate lower than normal oxygen levels, and this now because the administration of oxygen is part of this nitrous oxide, as I said before, the elevated levels of oxygen are actually a major advantage for these patients. For patients with liver disease, most sedative drugs require biotransformation in the body, and nitrous oxide does not undergo biotransformation with the body, and it's basically exhaled intact. So it enters the body and leaves the body in basically the same form. And so medically compromised patients with liver disease who need nitrous oxide sedation are good candidates. People with epilepsies and seizures, typically increased stress and anxiety help to precipitate seizures. And nitrous oxide, one of the benefits is that it is non-epileptogenic. That's a hard word to say. So it's basically not going to start a seizure. And really, epileptics are really sensitive to decreases in oxygen intake. So they're sensitive to hypoxia. So you want to make sure that with these patients, you're giving them really kind of the best treatment that they can get. So nitrous oxide is a benefit for them because if you can reduce the anxiety and the stress, which are triggers for the seizures, you can reduce the likelihood of a seizure occurring. Now, a very important point that you need to be very, very careful with is pregnant women and nitrous oxide. If nitrous oxide is used in the first trimester, it has been shown to produce spontaneous abortion. You also have to be very careful when using nitrous oxide around any pregnant women in the office, including yourself if you are a pregnant woman, or your staff if they are pregnant women during the first trimester. Now, does this mean that you can't use nitrous oxide on any pregnant women? The answer is no. You can use nitrous oxide on pregnant women, but it's always good to remember the following. The use of nitrous oxide in the first trimester is absolutely contraindicated. Second, the use of nitrous oxide during any other trimester should be approved by the patient's OBGYN. And third, nitrous oxide crosses the placental barrier and produces the same degree of CNS depression in the fetus that it does in the mother. So very, very important. Let me repeat this again. This is going to come up again on the exam. The use of nitrous oxide in the first trimester is absolutely contraindicated. The use of nitrous oxide during any other trimester should be approved by the patient's OBGYN. And nitrous oxide crosses the placental barrier and produces the same degree of CNS depression in the fetus that it does in the mother. Very, very important. Now, we said that the third group of patients are gagging patients, and nitrous oxide effectively eliminates severe gagging. It may require placing the patient in an upright position, and it's really practical for the use in short procedures such as radiographs or impressions. Now, nitrous oxide use carries with it very few absolute contraindications, but several relative contraindications. So, for patients who have some of the contraindications, relative contraindications, are for people who have compulsive personalities. These are people who don't like losing control. and they tend to fight the effects of nitrous oxide. So, if you have that patient that's really just very particular, very controlling about everything that occurs, probably not a good candidate. You could still use it, but probably not a good candidate for a controlling person, because nitrous oxide administration does make you feel like you're losing control. And that tends to make the person kind of want to regain that control, and so they kind of fight the effects of nitrous oxide. The second type of patient that really is kind of a relative contraindication is the claustrophobic patient, because they're really unable to tolerate that nasal hood. And you don't want to use a nasal cannula for this, because those nasal hoods that we have for the nitrous oxide in the clinic have a scavenging function to them. So in other words, what that means is that any nitrous oxide that might be breathed out around the mask is sucked right back into the mask and eliminated from the system. And so we don't want any of that extra nitrous oxide leaking out into the room. And that's what scavenging is that these nasal hoods try to basically collect all of the unbreathed or exhaled nitrous oxide, and then basically suck it back out of the nitrous oxide system. The other type of patients that you don't necessarily want to use nitrous oxide on are children with behavioral problems, because it really requires some cooperation from the patient. So if you have a pediatric patient and you put nitrous oxide on them, and it's going to be over their nose, and they're screaming and they're mouth breathing, they're crying, they're not going to get any benefit from the nitrous oxide, because they're not breathing it in at all. They're using their mouth for most of that breathing action. And you also don't want to use this on patients with personality disorders. Now, this isn't because this alters the way that the drugs, the psychotropic drugs they might be on, it doesn't necessarily interfere with the way that these drugs work. But what happens is that you have somebody who already has kind of a tenuous grip on reality. Introducing nitrous oxide also makes them feel like they're losing control, and it's really not a good situation for a patient who already kind of has a very loose grip on reality. Now, nitrous oxide is not that useful in patients who are sick. So if they have some sort of respiratory tract infection, if their nose is clogged or stuffy, they're really not going to be able to breathe in any of the nitrous oxide, and they're really not going to get any benefit from it. Any patients with contagious diseases should have their own disposable rubber goods, so their own nasal hood, their own tubing, their own reservoir bag, and that's the green bag, so that they minimize the risk of cross-contamination. And the last patient population for this slide is COPD, that really nitrous oxide use is a relative contraindication. And this is because of what I said before. These patients already have a difficult time getting oxygen from the air, and so if you introduce nitrous oxide in there, they're going to get even less oxygen. Now, it's really important for the use of nitrous oxide in all patients, no matter who they are, that you have the appropriate monitoring equipment. So that means using a pulse oximeter to monitor the patient's respiratory rate, the oxygen saturation, and the heart rate. It's going to be really important for you to have that every single time. And the last group that we'll talk about is pregnant patients. And we've already talked about what's really important. Avoid use of nitrous oxide during the first trimester. It's safe to use during the second trimester. And it's really important to avoid using it during the third trimester, especially if it's really close to the due date. And what you need to do, remember, is to contact this patient's OBGYN to make sure that the use of nitrous oxide will be safe for this particular patient population. Now, in emergency situations, nitrous oxide and oxygen sedation is the safest form of sedation for these patients. And I do want to let you know that nitrous oxide is sometimes used for patients in labor and delivery. Now the difference is, I've told you that the third trimester, it's really important to avoid it if it's close to birth. But the difference here is that in these situations where it's being used in labor and delivery, it's being used by the OBGYN for a specific reason related to pain and anxiety control at birth. Okay, so they're using it for a very particular medical function. On the other hand, the difference with us being that we are using it for a dental function that may possibly have a negative effect during, maybe spurring on the early birth of the child. And so you have to be really careful. They can use it for whatever they need to use it, and they're responsible for any liabilities that may occur or any adverse events that may occur while they're using it. And the same thing goes with us. We have to be really careful about how we use nitrous oxide during the third trimester to avoid any adverse effects on the mother or on the fetus. So I think this is a really good place to stop for video 2, and we'll pick back up on the next slide, which will talk about the chemical preparation of nitrous oxide. Thank you.